Welcome back to the Back on Track Achieving Healthy Weight Loss podcast. I'm your host, Dr. Alicia Shelly. So the other day, I was speaking to a friend who is living with obesity and has been on GLP-1 medication treatments. And you know what? She's seen results. As she noticed her weight was decreasing, but recently she hit a bit of a plateau. She still wants to lose 20 pounds, but when I suggested that she increase her dose to break through the plateau, she was like, no, I want my skin to catch up with my weight loss. And I was a little bit confused at first. And then she explained to me her concerns about getting more wrinkles, more flabby skin under the arms. And that's why today we're diving into this topic that has been circulating widely on social media and in the news lately. It's the Ozempic face or Ozempic body. And really, I want to address kind of the broader concerns around body image that can emerge during rapid or significant weight loss. And to be honest with you, these concerns I see a lot in my practice. So I've had a lot of people discuss the fact that they're concerned about the change in their body as they lose weight. Now, the one thing I will say is that whether you're using a GLP-1 medication like Wegovy or Zepbound for weight loss, or even Ozempic, which technically is FDA approved for diabetes, but people use it for weight loss, or even if you're just on your own lifestyle interventions like changing your diet and exercise, you will notice changes in how your body or your face looks. And with that, it can come with a wave of unexpected emotions and questions and even some discomfort around our body. So today, we're going to be exploring what Ozempic face actually is, why these changes happen, how to cope with the evolving appearance as you lose weight, and how to keep your focus on health and not just appearance. So let's get into it. What is Ozempic face? Let's start with that term itself. This phrase was actually popularized by dermatologists and the media, and it refers to changes in your facial appearance that can happen with rapid weight loss, especially with medications like Wegovy or Zepbound. And some people describe these changes as more sunken cheeks, prominent cheekbones and jawline, looser or sagging skin around the chin or even the eye area, or just looking a little bit more aged or tired looking because just the way the skin is laying, or some wrinkles here in the face. Now, here's the important thing to understand is that these changes are not unique to Ozempic or to any of the GLP-1s. It can happen with any significant or rapid weight loss, whether it's through lifestyle interventions, bariatric surgeries, or medications. So what is scientifically going on here? Well, the one thing I will say is that weight loss is non-selective. I have a lot of patients who are like, I'm losing weight everywhere, but not where I want it, which is in the stomach. And we can't dictate where we lose our weight, whether it's from our belly, whether it's from our hips. But you know what? We can also lose fat from our face, our neck, and our hands. And the facial fat, which is basically the fat layer that's under the skin, plays a big role in giving the face the volume and youthful appearance. And when that body fat starts to decrease, your face may look leaner or even a little bit older. And we have to also admit that as we age naturally, there's a reduction of collagen and elasticity in our skin. So if somebody loses weight quickly, especially if they're older, they may notice that these changes are more dramatic. They may have more wrinkles in the forehead or more wrinkles here along their smile line. And that's okay. It's a natural progression. Now, let's talk a little bit why this happens. And I want to pause here for a second and just say that these changes can bring up a lot of emotions. And that's completely normal. I've had many conversations with patients on whether they even wanted to undertake this health journey because it could mean that they would develop more flabby skin, more wrinkles in their face. And unfortunately, I don't have a crystal ball and I can't tell you how your body will react. And you might have wanted to lose weight to feel more confident or more healthy or more mobile. But now you're having people that you did not ask their opinion comment on your face, comment on your body, the extra flab, the extra skin. Oh, or you may even look at photos of yourself and say, oh my gosh, is that me? I look so different. And maybe you may not recognize yourself. Or maybe you feel like you've lost a little too much volume in the places you weren't expecting. I remember I had one friend that stopped wanting to lose weight because she lost too much fat in her booty. Needless to say, we all have different places that make us feel who we are. And I will say the tricky part is that our culture and our society and our community praises weight loss. They're like, oh girl, you look good, you lost weight. But then they will turn around and criticize the very signs that show it's happening. So you may hear things like, oh, you look so tired. Are you okay? Or, man, you lost too much weight. Or, you're getting too skinny. You're losing your booty. Or, I liked your face better before. And all these thoughts and all these comments can really get into your head. And suddenly, this celebration can turn into confusion or even shame around something that you should be so happy that you accomplished. And this emotional tug of war is a big part of the weight loss journey, but just doesn't get talked about enough. And for those who already struggle with body image, this can be especially hard. You might be healthier on paper, but you know what? Inside, you still feel insecure when you look at yourself in the mirror. So let's talk about how to navigate these feelings and these body image concerns, but in a more healthy and compassionate way. So the first thing is we have to normalize the change. Facial body fat loss is common and expected part of weight loss. But it doesn't mean that something's wrong. It means your body is adjusting. You are losing body fat, gaining muscle, and gaining body water, which is what you wanted in the first place. And this is especially true if you lost a significant amount of weight in a short amount of time. Also, number two, you can consider doing what my friend did and pace her weight loss. If you're on a medication and losing weight very rapidly, talk to your doctor about sometimes adjusting your dose or just slowing the rate of loss, which can help your body or your skin adapt more gradually. But like I said, there's no guarantee. I don't have a crystal ball. I can't tell you how your body's going to respond because we're all made differently. Some of us are pear-shaped. Some of us are apple-shaped. It just depends on our body. The third thing, prioritize resistance training and eating a more high-protein diet to start with. I sometimes hear all these different myths that you should not start exercising until you lose weight. But the actuality is you should start exercising as you are losing weight because that strength training can help with toning the muscles. So number one, you're burning more calories at rest than if you just did not do anything at all and you just have body fat. So muscle tones the body. It allows you to burn more calories and kind of protects the skin so it looks tighter. And that strength training and high protein diets can help you preserve lean mass and maintain a more balanced body composition. Also, it's important to drink water. Stay hydrated and support your skin. Hydration, gentle skincare, and sleep all support skin elasticity. And this won't reverse major body fat loss, but it can help you look and feel more refreshed. So get that water in. Also, if it's becoming more of a problem for you and it's affecting you, explore aesthetic treatments if you want. Some people choose to do cosmetic options like fillers or microneedling or collagen stimulating treatments to help them with the extra wrinkles and things of that nature. And honestly, it's your personal choice. No one has to know. And no judgment either way here. You got to do what helps you because it has to come from a place of self-care and not pressure from your family or friends. The next thing is focus on the function, not just the form. Like, for example, are you moving more easily? Do you have more energy? Are you sleeping better? Are you having better lab results? Are you cutting back on your medications? These are all wins that matter the most that will help you down the line. So a leaner face or a little bit of flabby arms is just a small part of a much bigger picture. Lastly, it's important to get support, whether from a therapist, a support group, or a trusted friends. Talking about your changing body image can help normalize what you're feeling and reduce anxiety or isolation. And it's so important that we just tune out the noise of what people are saying, what some random comment that somebody mentioned to you that was not solicited. Tune those out because haters are going to hate. And regardless of who you are or where you are in your station of life, there's always going to be somebody who is going to hate. And that's okay. That's about them. It's not about you. It's all how you perceive it and how you move forward. So tune out the haters. Next, let's talk about that social media impact. Because to be honest, it's fueling a lot of these body image pressures. I mean, You've seen the dramatic before and after reels, the side-by-sides, putting out facial changes, headlines, calling out celebrities for looking too thin. These images can lead to either unfair comparisons, unrealistic expectations, and constant self-scrutiny. And if you're finding that scrolling is leaving you feeling worse about yourself, it might be time that you curate your feed. Start following accounts that show diverse bodies aging gracefully and celebrating health at every single stage of your transformation. Because guess what? Your mental space matters, and just as much as your physical health. And you can change that. You don't have to look at these people's pages that are making you feel some sort of way. Just turn it off. Turn it off. In conclusion, here's our takeaways today. Yes, Ozempic face, Ozempic body is a real phenomenon, but it's not something to fear or to be ashamed of. It's a natural result of weight loss and aging. And it's absolutely something you can manage with support, with self-compassion, and with the right medical guidance. And most importantly, you are more than your face. There's more to you than just your appearance. And so remind yourself of that. You are on a health journey. It's not about fitting into your society's ideal or your culture's ideal. It's about you feeling better in your body, reducing your health risk, living the life that you want to live. And if you're feeling uncomfortable in your skin right now, you are not alone. We all are. And regardless if we are living with obesity or living with living in a normal way, regardless of wherever you are, there's always going to be somebody who's feeling uncomfortable where they are. And that's okay. That is okay. So many people go through this during their health transformation. And you just have to give yourself permission to celebrate your progress and not necessarily your appearance. And it's important that you be kind to yourself and give your body the time to settle. And remember, confidence does not come from perfection, but from self-respect. If this episode spoke to you, please share it with somebody else who needs to hear it. And if you have questions, feel free to DM me a topic and I'll be happy to make an episode podcast just for you. And until the next time, I'm your host, Dr. Alicia Shelly, reminding you to celebrate progress over perfection and stay strong, stay committed, and stay consistent. See you next time.